We'll talk about communication skill in medical education. This is a very vital subject for you, for your future as a medical practitioner. يعني communication skill, communication between people. لهمو بروفيشنال تيكا نكها دكتوري يعني دوكاناريك بيوستي با communication skill كي باش هي ويكا مشتركانا communication كاتو بالشكل سركتوبيا دكتوري بهمان شيوا ومسألة communication skill دراسية لبدايتها للبزنس كاني ترى ودسيكير almost from the 70s of the last century 40-50 years ago, being taught in the medical education وإنجا دعاء وكذلك ضرورة و medical practitioner هو ببشك لمنهج. So you have to learn communication skill to know how you communicate with your clients, which are your patients. Okay, actually, communication skill is within the scope of all specialty. يعني كل هالبرانش اللي لسنا نشكي أبي communication skill كي باشي أبي بزاني what's the communication skill. But I've been involved in this module because the first year when we changed the system of learning in the medical school from the classical one to the integrated one, I was involved in the process and I was oriented about that. So I put the schedule and the program for the communication skill module. لما صار كم جدول كم دانا محاضرة كم دانا محاضرة كم توا يتنوى شن صالة هم صالة introduction كان بجيش كسي كنا لكم بجينا شغل موين. Otherwise, my specialty is in pediatric surgery. Okay, but it is important for all of us to know about basics of communication skill and to have this skill in our daily practice. We as a doctor, we have to have an effective communication first with our patients. When we say our patients, it is a medical interview. So we have to know how to communicate with our patients during medical interview. And we have to know how to communicate with our colleagues, with our peers, and with the outside of the hospital or the organization that we are working with. مثلا حتى لو إعلام لو local authority, you need communication skill to communicate with the surrounding. This frame for the medical interview is the base of your daily life as a medical professional. First of all, when you see your patient, you start the session, the interview. So you have to know how to initiate the communication with your patient, how to initiate the interview, to establish an initial rapport and good relationship based on trust with your patient. And then you should identify the reason for consultation, to know why this patient is coming to you, what he or she seeks or asks from you. Then you start to gather information from the patient. You take the history from the patient to explore the patient's problem, to discover the biomedical perspective, the patient's perspective, and the background information. معناها من the context كانتو information أنا لأن فرشة ورقي. Then you do physical examination. You have to examine the patient, whether general examination or systematic examination according to the problem of the patient. And then you start explanation and planning. You have to provide the correct amount of and type of information to your patient. It's not only you that taking information from the patient, you also give information to the patient about his condition or her condition. Then aiding accurate recall and understanding, you make sure that the patient understands all the information that you are giving. Then achieve a shared understanding, incorporating the patient's illness framework. So you and your patient should know about the problem and all aspects of the problem of the patient. And then planning shared decision making. You involve the patient in the decision making process, whether to choose this way of treatment or that way of treatment, whether to have the treatment now or in the future, and so on. And then you have to close the session. So you ensure appropriate point of closure and forward planning, future action, how it will be. So this framework of interview, in the future you will study in detail and it will be repeated to you just to have an idea about the medical interview, and you need a good communication skill with your patient, and you have to know how to deal with the situations, in different situations, different kind of patient, يعني how to undertake this medical interview in reaching the diagnosis, how to undertake this medical interview when you have bad news for your patient and you sit down with your patient and tell the problem or the bad news. Okay. So communication skill is an important skill we all need to acquire early in life. هو لمناليوه وما قلتوا لو very good this communication skill. And we are continuously refine this skill. يعني بالدوام أم skill man باشتري. Communication skill open the gate of understanding, and the better we understand our patient, more efficiently we can diagnose and treat them. حتى communication man باشتري لأنه فرشة كان معنا. هيوديك باشتري. قشتن بتشخيص باشتري وعلاج كدنيش باشتري. And lack of communication being the root cause of unsafe, tragic, and unsatisfactory healthcare practice. So let's communicate better to avoid easily avoidable matters. زوربي كيشك هدروسة به كان يخرج دعاي شكاتك على الدكتور. It is because of bad communication. أجا تو communication skill باشك به and you communicate with your patient effectively, you avoid a lot of problems. This is just to ensure why it is important to have communication skill as a model, and why it's important for you to learn this communication skill and to know about this communication skill. Why we teach communication skill? Because it is important to study the medical interview. Are there problems in communication between doctor and patient? Yes. A lot of problems happen. That's why to avoid this problem, we have to use this skill. Is there evidence that communication skill can overcome this problem? Yes. Will it make difference to the patient and the doctor and the outcome of the care? Yes. There are thousands of documents that prove this statements. That's why we are studying communication skills. That's why it's being integrated to the education system. Can we teach and learn communication skill? Yes, there are a lot of evidence that communication skill can be taught and learned. And there are a lot of evidence that learning is retained. يعني اشتيتني من بيشتغل من الدكتور No, at any stage of your life, you can start to study communication skill, and when you get this skill, you can keep it and use it continuously in the future, and even you improve it with practice. Then, is the price on offer to doctor and their patients worth the effort? يعني أوفر تيكا communication skill أو أهلك إمام كويلاك نخواني كويلاك for sure it make a lot of difference. Okay. When we do a medical interview with a patient during this cycle of communication, first of all, at the end of the module, you have to have knowledge. يعني إما هدفك كما أنا وياك تورم اشتعنا هذا. يكم knowledge علم كم بيدك زانياري كان بيدك زانياري دباريشي. You should be able to explain the importance of effective communication skill and the need for patient-centered approach in diagnosis and treatment of patient problems. أبي معلومات هذا لسه communication skill شون كاري جرا و previously most of the time when a patient was visiting the doctor, the interview was doctor-based. Nowadays, we are following a strategy that the interview should be patient-based. The patient is the center of the issue or of the care. Second, you should be able to apply the framework of this medical interview in gathering information from the patient. To know how to gather information, to describe how the use of effective communication skill can enhance the doctor-patient relationship, to apply the understanding of normal anatomy, physiology, and psychological functioning to the symptoms experienced by the patient, to describe the integral role of information retrieval skill in the study and practice of medicine. يعني ذلك رول أو معلومات عنك تولي للشلل لنا فوشكوا, and to describe the ethical principles and values that underpin good medical practice. So at the end of the module, you have to have a knowledge about communication skill, why it is important, how it is important, or it is effective. Second, you should have skill. يعني هذا ونية علمك كتير اللي نشتغل. Skilly communication بقولنا فوشة. زاني كشون معمولي لدرجة زاني كشون مزيد بيكون شون يقدر يشتغل شون يتبصر كبلي. So these are skills. Okay, the patient should know knowledge have it. Do you have a big skill have it? For the patient-centered approach, you should show skill to be patient with the patient and to deal with the patient's emotions. You should have skill to give information to the patient. You should have skill to do a general examination or systematic physical examination. كأمانة لموديول كان يتراو ولي يجري مثلا ولي يجري knee examination شو هذا chest examination شو هذا abdominal examination شو هذا وأمانة skill you have to learn it. Okay? So you should be able to demonstrate awareness of the ethical and legal concept of competency. حضر كانت إجراء يعني يكتب مشاهدة سهم شركة مهمة بلا معنى تو علم بيرو تو سكيل هي أزعلين شو المعنى اللي قلنا خوشة سهم شد your attitude بيكرنوات كأبي دائما بيكرنوات بوزيتيفاني بالنسبة نخوش لسه اشتغل and you should demonstrate appropriate professional behavior in a clinical setting يعني لا خصك عليها كدوام كده قلنا خوش هذا اشتغلها you should have a professional behavior and behave like a professional person, unconditional positive regard, يعني دائما positively thinking about the patients, your carriers and colleagues. And willingness to work with and learn from patients with diverse background and personal lifestyle. يعني أولا لك شو زعمل لقلنا خوشي فقيرو دولار لقلنا خوشي كسايكولوجي الأنكسيتي هي كنورمال كديبريشن كنورمال educated than educated so peer menal you should be able to handle all kinds of patients and a desire to support peer learning and personal development course company يعني هذا كان يشمل فهذا سيشتغل مهمة knowledge, skill and attitude. So far we have seen that there is need to teach and learn communication skill in medicine زعلمانك مهمة and this communication can be learned and it will make a difference in our practice so we can define a curriculum of communication skill curriculum and this module in communication skill showing lecture knowledge appropriately. Knowledge, skill, attitude. Knowledge showing appropriately. What skill either through a role play, video resource, group discussion, or even early exposure to the patient, real patient or simulated patient, you should get the skills. And by that time, your way of thinking, your mind will be changed positively toward your practitioner and toward your patient and the surrounding in general. Okay. These are the same repetition by the relative. Topic كان دكتورة تان كي تلقى the topic. And to get more information on communication skill, we have this book, Skill for Communicating with Patient. You have this book, Macroclinical Examination. You can get benefit from those. Another one is the Davidson Principle and Practice of Medicine, Browse Introduction to the Symptom and Sign of Surgical Disease. Amana زيادة يعني بتدي لويك how you get the skill of examination. Okay? So at the end of the module, you should be able to do all the following. You should be able to get information from the patient. You should be able to give information back to the patient. You should be able to, hello. Again, this communication between me and you need a context, need a special situation so that the message will be sent to you clearly and you can get the message. Any interruption will affect our communication. So you should be able to deal with different kind of patient and different, for example, breaking bad news, elderly patient as we mentioned. These are our aims of teaching this module of communication skill to you. بالنسبة لامتحانه لموديول الرابع عام testing the knowledge can be done actually the MCQ written assessment لكي وكو هيك لم سنستريع بشوي MCQ برسيالي بوي هيك جوا testing the skill كان in the form of OSCE. OSCE شونا إما علين you should learn how to deal with let us say breaking bad news. OSCE station هيك كنسيب ماندانا علين أمنا خوشة دوائف بساطة جدا تقول كما علين سي كومونا. How you tell them. And the examiner will not ask you anything. You just have a checklist and look at you how you communicate with your patient. Who he tick the points and give the marks to. This is how you will be assessed in the communication skill module. أمس مستر امتحاني تاعي وكون دكتورة متي لهي داهاتوش أصالي داهاتو بهرنش امتحاني تاعي. At the end of the third year, saying you will have assessment in the communication skill, and in the whole 6 years of your teaching and in the future, every day you will be assessed for communication skill by examiner, by patient, by community, by everyone. So this is a very important and vital aspect of practicing medicine. So, in communication skill module and during assessment for communication skill, you are not expected to make diagnosis. إما الطبية كمان ناية. إما communication كمان ناية. لا سر أو assessed, okay? Or you may be assessed in doing some part of examination or according to the body system that you are taking. This is an example of OSCE. A patient, 42-year-old named Nasser, he has chest pain. Basha, علينا نخوشي معتوب ولايته تشدو صاروا chest pain. وباوي تشندقه examiner لك كوستارا هيش ناكا بس هي تو كابزالي توتشون how you open the session for taking information and giving information with this patient. And he has a checklist. If you look, the searching assessment questioning the patient, probing, confrontation, paraphrasing, verbal interpretation. So not on medical knowledge, on how you communicate, you will be assessed. Another scenario, breaking bad news, when your patient has CA colon and you know that the patient has CA colon, how you tell the patient. And the examiner will assess you how you set up the sitting with the patient, how you patient perception of the condition, invitation, knowledge, emotion, empathy, strategy, and summary. But this is short talk about communication skill module, and by now we know why communication skill is important and how we will be assessed at the end of the module. أما بشي يكمل مكو introduction module متابعة مو communication skill module. Esther basic communication cycle as the base of communication between any two human beings in any aspect of life. لك هذا الطبع لا همو مجالك. عشان Communication will be between the sender, me as a sender, I have a message and I want to send this message to you. So sender, the message, you as the receiver, and you should give feedback to me that you received the message. This is communication cycle. Okay, أما لبيني بنتوها لبيني توها وركتاك شتى شرحك لبيني تو دوكانا لك كشتى لكريم بيني همو دوكاسيكا when they communicate. So communication is the act of being understood. And communication about being understood. It is a process which involves sharing information between people through continuous activity of speaking, listening, and understanding. يعني أتوانين بشوازي كتربلين communication شيء is the giving, the receiving, يعني exchange of information, opinions, or ideas. I'm exchange by writing, verbal, non-verbal, or any combination of these three ways. That the material communicated is completely understood by everyone concerned. I'm a communication cycle. Okay, so importance of this communication leads to personal effectiveness. Help to network with people, affect or influence motivation for enhanced performance, build better understanding between the boss and the subordinate, between colleagues, create a better interpersonal relations, and increase listening ability. أمانة همي استفادة أو communication cycle بمزبوطي تطبيقه. So, to go more detail for the communication cycle, we have the source, the sender, which has an idea or a message needs to send to the receiver. أبي أو مسجات encoding بك بشوازك expression بك دل بروي binary من idea explanation كمايا أبي كوديك encoding بك كوديك بكوديك بروي binary موتو باشا أو كودينر لرغي channel كويا بونمونا speaking بونمونا body language or writing or a picture or an email يعني لرغي channel كويا عينيري كمسجك قشت دسيتو وكو receiver you should decode the message and then you will take the idea. And when you take the idea, then you send the feedback to the source, and by this feedback, again, then we make sure that the message being understood by the receiver. So communication process, the word process indicate that it's activity that's connected with a series of steps that are deliberately undertaken to reach the goal. أمش كهذه الرؤية لكونتكست كهالرؤية يعني أما سجى كيسمون منا communication cycle كمن أما بيجي من بتو. It was an idea in my mind. I encoded it, okay, and then through a channel which is writing, verbal, body language, non-verbal, and so on, I send it. You decode it, you take the idea, and when you ask me more detail, or when you make sure that you understand, or when you discuss the cycle with me, then I make sure that you understood and you received the message. This is how it takes place. So these are the elements which is involved in the communication skill. First, the idea. The idea, information exists in the mind of the sender. كأنه sourcey message here. And this information can be a concept, can be an idea, or an information, or a feeling. يعني message لو عليه هذه لماذا. Second, encoding process. من idea كم استهيا يعرف لنا كم هي. أبي بش بيقول مشروازك ويبيني الموتو أو قولي نبيل encoding. The source initiate a message by encoding the idea or the thought in a word or a symbol and send it to the receiver. The message is the actual physical product from the source encoding. إذن أو encoding لو عليه جملة تقسيم. So the speech is the message. Writing is the message. When we gesture, movement of our body is the message. Okay? Facial expression is a message. يعني feeling هي encoding كله facial expression وبوا أيديه بوا receiver. Then the message should find its way to the receiver through a channel. أبي بريجيه كابت. كأوريجانا is the medium that the sender used to transmit the message. إنجا ريجي جياواز هيك message بيعملهم. We have to be to take care in selecting the channel. We have different channels. So in selecting the most effective one. من بيبزان idea message كأيديهم وتو. The facial expression باشا يعني بقصة. بلوسين باشا يعني برسم. بدن باشا يعني body language. Okay? We have different channels of transmission. وعادة ليك channel زيادة دو سي يعني زيادة بكاره هني بويكا نعمل بقيني هو بالعمريكا. And you should know that, for example, oral and written channel or media may be appropriate to transmit a particular message, but one media may be more effective than the other. بنزعل نعمل أتوانم بموسيقى كي آواز داري برم، أتوانم برسمي كيش داري برم. بس نبزعل كامل كاري قلتها. أو رسم بداية دامن ماهو very simple. بقدر دورة كالموسيقى نعمل كأجينة توكل communication cycle شيء. So communication rarely takes place over only one channel. Usually 2, 3, even 4 channels are normally used. In addition, the sender should take into consideration skill in using each of the alternative channels. as well as the receiver skill in using each channel. ما بس ما نبت شيء من أجل باش نبني الرسمة نبي بحاول أكون برسم مشترك بين الموضوع بشرح ولا نعمل موضوع أجر خوم نبدي للوجا باش نبن رجعي كده أبي يعني أبي بزانم خوم نتشرب رجعي كباشم نتشرب رجعي باشم ونعمل كبوي بينهم وأبي حسابي الرسيفر كشكم نكتب زالم توبول من المكاهناني إيميلا باشتي نبي لإيميل نامه يكتبون بينهم چه رگه دوتو باشتر گوجاتره أبي أو رگه هالشيء. And we have different channels for transmission: face-to-face, interactive TV connection, telephone, email. Personal written correspondence, written message, public speaking, data report. أمانة يعني قصة قبل إعلامه نازل بوستر بلاوة كيتو أمانة همي different channel of communication. باشا نامك لرجع channelك هو أشبه receiverك أبي decodingك. It is the act of understanding the message, which is a word or a symbol. This is known as decoding. When the sound wave translated into idea, we are taking them out of the code and they are in, hence decoding. يعني هو كتور نعم كلا ظرف كذا دريني هو كبيخلي ده. This is decoding. Thus, the listener and the reader are often regarded as decoder. أو كنعم كولا غير أو hearing decoder. However, during this communication cycle, two processes will be received by the receiver. يجي كان content محتوى اشتكى نعمته كولي المهم يعني context أو جوي كتياتا والجرتوا. The content is the word or the symbol, which is known as language, spoken, written word, achievement. Okay? The context is the environment in which the communication takes place, which can be formal or informal. The circumstances surrounding the communication also make up the context. يعني بوئك أمنا ما بدابته أبي حسابي هالنعمة كنكرم حسابي environment كشبكين أجر جولك ساد من نعمة كباش نقابته أجر دنا دن زور بيت نعمة نقابته أجر مناشكة كبيرة. So this is the context. Okay, so the communication is two parts: the content and the context. And remember that a message is never communicated unless it is understood by the receiver. Question arises then: how do you know that the message has been properly received? شلون ضلنيا بيقول لو إيك نعمة كجيشتوا من شلون ضلنيا بو بويك الأخير محاضرة كيا تو بسيارة كي لسه موضوعك يعني قصتاني معلوماتك بعضين نسجك بشوازي كي تبدأ الرجي توائلي يعني ديتيلي في زيادة الدولة ضلنيا بوكا يعني دعي لامتحانات الزيادة يعني سيرك مزالم شون معلومة لقرأ في خلقة communication لقرأ نخوشكات شون لكي. This is how I know. بوشيك أنا زارو لأي مثالي شو كان medical interviewer بحمان شيرا. When you have a message and you want to send it to the patient, you have to know the encoding process. You have to select the appropriate channel, and then you code it, and the patient will receive the information. You have to select the context. نعم هلا مثلا خبريكم بيبو ولا خوشكم ولا ولا استبكش مجموعكم كاكو فاسرين هو ده شو لا the context كاكش keeping the privacy أشمل تنشتيوا شد بين معنا ندي و تيشاني لما I feel emotion or empathy toward this patient and then send the message. بوين أمسايكل أخواني وين كتبس مني أو هذا medical interview تطبيقي كده ضل نخوش Then feedback ده نخوش قوي رجلنا من توي ورجلنا تولا يجي تدي ورجلته وكلامه كبلادوا. By two-way communication or feedback, the feedback will tell the sender that the receiver understood the message, its level of importance, and what must be done with it. لما يجي feedback كويس هاي كلامه كبير كشأنه مهم بلايو كشيء كيدوايو. So the feedback loop is the final link in the communication process. Feedback is the check on how successful we have been in transferring our message which is originally intended. It determines whether understanding has been achieved or not. Feedback كيف كمان ولا message كون يداوا و تيجي يشتوا يعني. So the purpose of feedback is to change and alter message so the intention of the original communicator is understood by the second communicator. يعني مهم من feedback ولا درموا اگر زانیم بۆ نمونەی نامەکەم بە مەزموونی نەگەشتووە لەوانەیە چەناڵەکە باش ببێت چەناڵەکە ئەپۆڕم لەوانەیە ئینکۆدینەکە باش ببێت ئینکۆدینەکە گۆڕم بۆ ئەوەی دڵنیابمەوە لەوەی کە نامەکە ئەگاتە دەست ڕسیڤەرەکە و بە باشی تێگا. So feedback include verbal, non-verbal response to another person's message. مجدية verbal ولا علينا verbal and these are the ways of feedback. لكمشن evaluation أجر receiverك تقييمك دانا evaluate message كده بعد message كده بس تقول evaluation يكا making a judgment about the worthiness or appropriateness of the message. Interpretation. كاتك مسجك لو بدس قشتوته بشيوي كتير إليتوا همان شو بس بشيوازي كتير إليتوا paraphrasing. So attempt to explain what the sender statement means. يعني كاتا تيجشوا. Supporting the idea. معناه تيجشوا. Probing when you ask for more information on the topic. أنا كاتا أميكي قشتو. And then understanding, attempt to discover completely what the sender means by the statement. By that, we know that the receiver received the message and the message being understood by the receiver. The presence of noise can result in fairly significant problem in the communication process. Çünkü o communication cycle, the sender, the receiver, and the other elements, there is a knowledge, a message, which is important, and the context is important. يكشف لنا noisy environment بس يجيكم واضح هنا بعدين receiver. Unfortunately, communication is affected by noise, which is anything, whether in the sender, in the transmission, or in the receiver, that hinders communication. يعني هل بسيط ليش لسه كجانوي داتا شوكة زوزو أو هيك كلا obstacle كان communication cycle إيما. اگر زونا کجایت و نامه که باشتر است. اگر رسم همه مثلا نه دیگر لا اینکودی مسیج کنه. لانه همون اول موسیقی پاراگرافه زعجلی دیدنی. بس که رسم به زیاتر لێتەیەگری and so on. و ئەم سایکڵە ضروري بیزانین بۆ چونکە ئەمە this is the base of the communication between two people. You need it in your daily life to communicate with your sister, with your brother, with your surrounding, with the shopkeeper, with your teacher, and with your patient as a medical practitioner. شكرا كإنترفيو أكيد قبل نخشيكا. You should know how to take information, and you should know how to send information to your patient. And you should take in consideration the information, the way of sending this information, and the context. أول بعد كده سيشن كان يترى بالتفصيل وريه جدا يعني بسيطين شد لو هيك أجر من لسكن سكن داني شتون لازم دومتري لبردم معهم إن جعل خوشكا أن communication اللي عوازنا لو هيك أجر لفنيج نخوشكا ورمك بيت نخوشكا منيج لسكن سكن داني شتون لجاني أما أشياء تقالي كونتكست وزور شيء نبدي للفيديو جابون للجرب يكيت لدهات ووليه كسبسياري هي لسر communication cycle. In coding, I have an idea. Rasha, I have an idea. أبي أم idea بكم بمسج بوي بدي الموتور. أما in coding. channel أو رجية كمسج كيف يعني أم paragraph أم نسيبه بو ويكا ريجا كاني feedback ورجت نوبزاني. So this is the idea that ways of taking feedback from the receiver. أم بيجيها. أم paragraph أي نوسن أم إنكودية. أويك أم بإيميل من الموتور. أو channel. أويك إسأوا بيشان فيهم channel. When I read it, يعني verbal, legal visual, أو دو channel يجي أواسم أو بجار ويك بيدين كتو. أما أنا channel كمان. Any more questions? Okay. So, noisy environment may hinder development of clear thoughts. يعني شكل مظبوط نعمل. Encoding may be faulty because of use of ambiguous symbols. يعني زوجة لوانية واضح نبي أو encoding كبكار منها أو سيمبلي كبكار منها واضح نبي لبرو سيرتي أيديا كبواضحين على receiver. And transmission may be interrupted by noise in the channel, such as poor telephone connection. يعني معلوماتك بيه نعميك بيه بيجي له تلفون على وجهه مو channel. كخشخش كا يا شبكة باشنية سيرتي نعم كذا بمزبوط يعني هذا receiver كا. يعني نسبرنت text. text كم بمزبوطي print نكتبه هاليتي على جورو بشوكا عين شو أنا ambiguous symbol which affected the communication. So inaccurate reception may be caused by inattention. يكفي شو هو كاركاني تبقى communication cycle كا باش نبي receiver كا أجر attention اللي بيبغى نعمله for whatever reason. how. So by this we come to the end of this lecture. Kedu bashku, bashi yakamian, basi omanke, communications, what is the communication skill, and why it is important, and is it possible to learn communication skill? Yes. And do we as a medical practitioner need this communication skill? Yes, because it affects our performance and make us to deal with our patient effectively, to reach the diagnosis better, to give treatment better, and make the patient understand us better, and we understand the patient also better. So it is important, and we should apply principle of this communication skill in every medical interview we are doing with our patients. وأبي هل communication جامع نقل خوشة حتما نقل المباركشة بعد شوية دائم بيلو بينو so أجر من سندركم برامركم سندركم I have to think about how I send this idea to the receiver. I have to think about the way of encoding the idea, which one is good, should be clear, and then the way of transmission. Usually we select 2 or 3 channels of transmission together. شوية أجر سلايد عليه لقلنا ويا بس بسواه كان تبدو كي يشيل نعمل كذا بس verbal, visual, okay? And you have to make sure that the receiver receives the message by loop of feedback. هيجنا مثلا مثالي تأكيد يعني وكل حالة في خبرة الامتحان يعني إما اللي قلنا نخش على شوازي ده. You should make sure and don't forget the context. هل context مهمة؟ context مهمة أو بيئة نعمل كيف يعني